Pandemic Plan, Public Health National, George Mason University Project, HAB 445, Introduction to Health Services Research, Professor Annie Lasway, by Randa, Shiwani, and Lillian. On September 3rd, 2021, the White House Office of Policy and the National Security Council issued the American Pandemic Preparedness Plan in response to the sudden appearance of the COVID-19 pandemic. It was apparent that acquiring a pandemic preparedness plan can help transform and prepare our medical defenses, ensure situational awareness, strengthen public health system, build core capabilities, and manage the mission. COVID-19 has taken more than 1 million Americans and about 6.4 million people around the world. Many of those who recovered from COVID live with long or short-term effects. Evidently, COVID-19 was considered a moderate pandemic, and there are possibilities for future pandemics. It is my job as an executive director to enhance and support organizational operations through managing assets, financial operations, establishing goals, leadership, influence, growth, design, and direct strategies, comply with tax requirements, manage daily operations, develop and direct strategies, create organizational policies, manage performance reviews, create a budget, train the heads of different departments, and manage financial accounts. To develop a pandemic plan for the next 5 years, we need to combat any threats to public health safety, such as plans for crisis and emergency management, strengthen existing systems, implementation of evidence-based response, testing, revising, global risk assessment, and evaluation of pandemic vaccine effectiveness. Dear Congress, it is my duty to create an effective strategic pandemic plan for the American people. In the past 2 years of the pandemic, over 1 million Americans have died, according to the CDC, many of whom were family members, friends, neighbors, and colleagues that were dearly loved and missed. The federal government was not prepared for the COVID-19 pandemic, which resulted in significant increase in the number of morbidity and mortality rates of Americans. Additionally, COVID-19 pandemic has caused significant economic decline, behavioral changes, and political instability. Evidently, many research find evidence of an increased risk of pandemics due to the incorporation of international traveling, development of cities, growth, and in the increase in utilization of natural resources and environment. Therefore, creating a pandemic preparedness plan and response can help mitigate morbidity, mortality, health conditions, economic growth, and effects of social and economic instabilities. We can use these key elements of the pandemic preparedness planning cycle to plan for a pandemic preparedness. So first is strategic planning, operational planning, exercises and reviews, implementation, and evaluation. Our goal here is to save lives and ensure security and stability through surveillance and monitoring, contain and control, saving lives, community resilience, security, and stability. Recent COVID-19 outbreaks has challenged our tourism, public health, and government policy around the world. COVID-19 is proof of the need to establish a better global structure for health security. We can use this public health pandemic plan to be better prepared for pandemics through quarantine, place in quarantine and travel restrictions, development of testing, masks and social distancing, prepare and supply hospitals, provide housing for the homeless and those in need, public assurance, economic stimulus checks, and the use of artificial intelligence. Prepare and supply hospitals. Routine emergency response training programs for all healthcare employees. Management of infection control, proper use of PPE, hand hygiene, isolation protocols, admission protocols, and quarantine guidelines in order to focus on infection prevention and control protocols. Report cases in one epidemiological surveillance program in order to provide data surveillance of communicable diseases. This will help hospitals to maintain proper supplies and for policymakers to respond accordingly. Delaying of non-emergency and elective procedures to increase healthcare capacities and establish emotional support and wellness committee for the staff. Public assurance. National crisis can lead to instability due to fear and misinformation. It is vital for governments to communicate with the public in order to help them take cautionary steps like social distancing, hand hygiene, etc. Therefore, daily press conferences regarding epidemiological status, daily statistics, including number of cases and deaths, free medical care for everyone regardless of immigration status, maintain food supply, quarantine facilities, mass testing centers and laboratories, provide home care via telemedicine, deliver medications, and provide support services. Funding. The U.S. Department of Homeland Security provides access to grant programs using the Grant Programs Directorate GDP Information Bulletin. Um, the funding uh, is, is known capability to fill capability gaps and encourage innovative regional solutions to issues related to catastrophic incidents. FEMA implemented three new strategic priorities in 2022, which are equity, climate resilience, and readiness, with all have an emphasis on the need of disadvantaged communities and vulnerable population. Um, these are the fundings available through them. They have a total of $12 million. For the District of Columbia, there is the funding available that can be utilized is in the amount of 1,430,000. And that's our references. And thank you.